Insulin and diabetes. Obviously, a lot of our patients that we look after are diabetic, and we know that we need to be mindful with people that are diabetic because obviously pressure ulcers, they're more at risk. Again, nail care needs to be done by a specialist person. And we spoke last week, we did do vital signs last week, didn't we? We did last week about doing blood glucose, etc., in normal ranges. So now we're just going to look at raising the awareness around insulin. When I come out to see you, you will be observed administering insulin. So I will bring my mannequin along. I have to observe you, do the glucose and administer the insulin. You need to understand how to perform that, understand the associated risk with insulin administration, and obviously reduce the risk of error or harm to your clients. So in 2010, so there's quite a bit out of date data here, there was 15,227 insulin errors. We're probably roughly at the same now anyway, and 6 recorded deaths for insulin overdoses. So lots of things that we need to think about. So what can go wrong when you're giving an insulin injection, do you think?
Not giving the correct amount.
Okay, so overdosing or underdosing. So we're looking at basic medication policy here, aren't we? The 6 routes, 7 Rs or 12 Rs, whatever your Rs are. Yeah, so that's one. What else could happen given an insulin injection? What else could go wrong? Sorry?
I think you need to check as well the blood to
so if you have checked the glucose levels, you may be giving too much and then you're hyper. Yeah, so that could be another error. Think about your needles and sharps. What can go wrong when you're using needles and sharps?
Too big, too small, damage the
pen. Absolutely, you could damage somebody, so you could cause some tissue damage, infection. So lots of things that can happen that goes wrong. So what are the 6 R's to medication administration?
The right patient, the right dose, the right time,
right route.
The right route.
Right.
Right time, right medication, right person.
Good. Good. Okay, so we've got different types of insulin pens here. Have you all seen these insulin pens in your time?
Yeah.
Not yet. If you haven't, don't worry. When I come out and show you the pens, we'll do it together. But ultimately, these are the pens in which you get very typical. They've got the twisty bits at the top and they do a click. So if you're visually impaired, you can count the clicks for the units, but equally there's that visual bit. And obviously all insulin needs to be stored in line with the manufacturer storing, which is normally just at room temperature, cool but not cold. So that's fine. You shouldn't be drawing up insulin anymore. They should all be coming in the preloaded pens. You've got different types of insulin. You've got rapid acting insulin, which works within 5 to 10 minutes. We've got short acting insulin, which works between 30 and 60 minutes. Intermediate between 2 and 4, or long acting within 6 hours. So rapid acting is normally taken just before meals. And again, least likely to cause hypoglycemia, so that's the drop in blood sugar. Short acting, injected several times in a day. So that's just about keeping it more regulated. Lasts for about 2 to 3 hours, and then lasts for 5 to 8. Then you've got your intermediate, which is your longer lifespan and slower starts. Peaks about 10 to 14 hours and lasts up to 16 hours. And then obviously you've got your long acting. Where did insulin originate from? So where do you think insulin as a medicine originally came from? Because we've got two types of insulin. We've got a synthetic insulin and real insulin. Where do we...
Country.
China.
America.
So synthetic insulin is obviously made in a laboratory. Real insulin normally comes from pigs. So the real insulin, it was seen as going back 150 years ago. I can't remember the country. I want to say it was China. I want to say it was somewhere over that way. There was an incident where there was a shortage of insulin, and this woman decided to see if she could take it from a pig. She took it from the pig, and actually it became one of the longest lasting insulins there was, because it was a like for like. Obviously, we don't recommend you going into animals, taking animal insulin to test these things, but that's where it comes from. So equally, just knowing that gives you a bit of thing around equality and diversity, and around the right to know what you're injecting into your body. Because did you know that the original insulin comes from an animal? No. So if you are vegetarian or you've got those beliefs, you may find it difficult being prescribed an insulin that's got an animal product in it, where obviously there is the option between the two synthetics. That's fine. So different injection sites for dispensing the insulin. We're looking for nice muscly areas in where we can go. So we've got obviously our abdomen area, so we can just squeeze a bit there. We've got our thighs and our buttocks. Okay. So the reality is, when we look for insulin and we're looking for injection sites, we should be rotating those sites. So when you give insulin, you should record where it was given, because again, if you keep giving the injection in the same areas, you can cause the skin to harden and the skin to become a bit thicker. And that becomes a problem because the insulin needles are only subcutaneous. So they're only small needles, and that can obviously be a problem. So just knowing that you're looking for those fleshy areas with a fair bit of muscle around them. So in the injection sites, what you want to avoid is obviously having any lymphedema, so that it's where it's constantly being put in there, and obviously you end up with those massive lumps and things. So you want to avoid that. So again, having that rotation is really important, because nobody wants additional massive lumps in their body when you could be rotating it around and avoiding any of that happening. When we pinch the skin, you've got the right way and wrong way. So here we're going subcutaneous and we're just pinching it up, and we're going in kind of that way up. And again, what we're trying to do, we're trying to lift the skin up to get the tissue underneath and to get that nice fatty bit of muscle there. But what we're not doing, we're trying to pick the fat up, but we're not picking the muscle up. So if you see in the first one, they're going quite deep on that grab and you're picking the muscle up with that. When you're doing it, you're just getting the fat. And that's because the needle is small and it's subcutaneous. So it's not intramuscular. If it was intramuscular, it would be a bigger needle and it goes into the muscle. Subcutaneous means it's just going through the tissue into the fat. Yeah, so that's what we're looking for there. So that's the right way of a bridge. Equally, you may be told of a different technique, which is the Z track, and that's where you pinch the skin and you do that. So it kind of creates the canal. The problem is with this bridging is when you bridge up, when you put the needle in at the top, the fluid remains at the top. So when you let go, sometimes fluid comes back out. Yeah, so you just need to be mindful of your techniques. So looking then at the right time, obviously making sure you know if it's the short-acting insulin, you'll take your insulin with or straight after your meal. And if it's not, you may take the insulin on average between 30 or 40 minutes before your meal. So again, just knowing when that is. Side effects of insulin, people can appear to be agitated, sweaty, shaking, grumpy, dizzy, confused. They can have symptoms sometimes of being almost drunken-like and being quite agitated. But equally, you've got in those pictures there the blotching. So this is obviously all the needle marks and stuff. So that's poor rotation. Yeah, so that would be really uncomfortable for somebody. So what are the most common symptoms for hypoglycemia? And when I mean hypoglycemia, what do I mean by that?
It's low blood sugar.
Low blood sugar. So what's the common symptoms?
You're drinking a lot?
Yeah.
Nausea, feeling cold, dizzy.
Yeah. So what would be on the glucose machine? What's hypoglycemia on a score?
2.5.
So anything below 2.5 would be, yeah. So anything below 4 is seen as hypoglycemic. So that's grand. Anything hyper is anything above 7. And again, if you remember what we said last week, let me see if I've got it on here. I don't know actually if it's on this one. Is it? No, it's not on one of these cards. What I will do, oh no, actually in your training, sorry, you've got a grid and it gives you all of the scores. So it goes obviously below 4 is hypo, then you've got your 7 to, like there's a threshold of 15 where it goes slightly high, 15 to 20, something is considered to be really high, 23 and above is considered to be dangerous. So again, for your glucose, there are certain thresholds as those numbers go up that you need to be aware of. So mild hunger, palpitation, sweating, shaking, dizziness, tachycardic. Tachycardic is what?
The heart is beating faster.
Very fast, yeah. So it's beating too fast. Yeah. Moderate then, confusion, drowsiness, lack of coordination, speech slurring, and aggression. So actually, this is the bit where it starts to look a bit like somebody being drunk. So it's that really strange behavior. And then severe, you're looking at loss of consciousness, into convulsions, etc. So anything less than 4 mmol, you're going to be looking at hypoglycemia. Treatment for hypoglycemia then, we're looking at a glucose intake, or if you've got those glucose sachets, you're going to put in the gums and whatever. Again, should be a PRN if you've got those glucogels, but we're looking for a sweet substance to bring it up. So what are the common symptoms for hypoglycemia? So high blood sugar.
Sweaty?
Yeah, sweaty.
I think it's the same, still the same, isn't it?
A lot of them, yeah, absolutely. It's very hard to tell. Same symptoms. The only way you're going to tell is if you do the glucose. So yeah, so you need to be mindful of that. So equally, everyone that has insulin should have an insulin passport or some kind of book where you can track what their normal glucose are. Do any of you dispense insulin at the moment?
No, I'm not allowed. They've said to me I'm not allowed.
Okay, so obviously part of your assistant practitioner program, you have to learn how to do it. So you'll do it when I come out to see you, that's fine. But basically just be mindful that insulin is like, it's like a normal, it's medication at the end of the day, it's a drug. You've got your EMR chart and it will say, give 5 or give 10 units of insulin.
I've seen how they do.
Perfect. The only time it differs is when somebody's going into a hypoglycemic attack. And what it says there is a PRN. So it will say for every unit that they're up, for every unit they're over 7, you normally give another unit of insulin. So for example, if I was 20 and I should be 7, I'm 14 units different. So I would have my normal dose plus 14 units more. But it works out, there's no rule to it. It's done by the doctor. So you must make sure you have read the PRN medication for somebody who's on insulin, because you've got your normal administration, your morning and night, and then you need to know what to do in the event of a hyperglycemic problem. So when there's too much, and it will normally say on the MAR chart, give this plus, and then it'll say however many units. Okay, be mindful it's different per everyone. Okay, so how do we rotate our injection sites? Oh, yeah, so how do we rotate our injection sites?
We do on different areas.
Yeah, so we're just going to just ask where the last place was, and we'll record it and say, gave it in the left abdomen, so now we're going to do it in the right. Gave it in the left bum cheek, now we're going to do it in the right. So we don't cause that hardening of the skin. And actually, it means throughout the day, we're not injecting more than once into any particular site. Okay, so how do we check blood glucose before we give insulin?
With a blood test machine.
Yeah, so you're going to wipe the cord, clean the finger.
Yeah.
We're going to go in the corner of the finger, not on the pad, corner of the finger, drop in that machine, and it tells us. And again, I do have to observe you do that when I come out. There are videos online on how to do that. Okay. So that's insulin, that's fine. Right.